Hello, my name is Kaci Sims, and I'm going to be talking about the importance of hand washing and its effect on patient safety. This is a national patient safety goal set in place by the Joint Commission, and I'm going to be talking about the importance of meeting that goal. This is patient safety goal number 0.07.01.01. It states that we should use the hand cleaning guidelines from the Centers for Disease Control and Prevention, or the World Health Organization, set goals for improving hand cleaning. Use the goals to improve hand cleaning. Hand washing is one of the first things we learn in nursing school, and it seems so simple, but it's actually one of the first things that we forget that is so important to our patients' care. Forgetting to wash our hands or not washing properly openly puts our patients at risk for infections that they did not come in the hospital with, and it is our job as nurses to protect our patients and keep them safe by adequately washing our hands and doing our part to break the chain of infection. The importance of hand cleaning. Estimated 2.5 million hospital-acquired infections, or HAIs, occur annually in the U.S. Deaths due to HAIs are usually accredited to subpar healthcare practices by employees, particularly poor hand hygiene. Improving hand hygiene will decrease patients' risk for infection and in turn improve patient safety during their hospital stay. I know personally as a nurse, I never want to be the reason that I keep my patients in the hospital because they acquired an infection from me not doing my part in keeping my hands clean and doing adequate hygiene routine to keep my patients free from infection. I know that I want to be personally committed to meeting this goal, so I'm personally committed to performing with adequate hand hygiene and using some of these guidelines in order to keep my patients safe. This is a chart that we track the use of hand hygiene on my floor, and this is a chart that is showing where we did or did not meet our goal for washing our hands, and this is for June. And so my goal is to see this line move higher and us use more of the alcohol or the soap in our bathrooms. Okay, this is a scenario that involves the lack of hand hygiene and how it can affect our care and affect our patients. So just listen closely as I go through this scenario with you. Nurse Kaci walks into a patient's room to do an assessment. She walks in and forgets to use the hand sanitizer that is on the wall in the patient's room. Before putting on gloves, she pushes the patient's bedside table out of the way, touches the IV pump, and puts her hand on the patient's shoulder before starting her assessment. She then realized that she forgot her stethoscope in her locker and exits the room, forgetting again to use the hand sanitizer that is in the room. What Nurse Kaci doesn't know is that the patient will test positive for MRSA later that afternoon. Before Nurse Kaci is able to make it back to her patient's room to finish her assessment, she hears another one of her patients calling for help down the hall. She rushes into the room where she finds her unsteady elderly patient trying to make it to the bathroom by herself. She quickly grabs the patient's hand to assist her to the toilet. She then helps the patients back to bed where the patient continues to finish their breakfast. In this scenario, Nurse Kaci failed to break the chain of infection by using routine hand hygiene and personal protective equipment. By failing to wash her hands and wear gloves while interacting with her patients, she risks spreading MRSA from one of her patients to the next. Contacting MRSA can increase the cost of the patient's stay, the length of the patient's stay, and the patient's risk for developing sepsis. Using hand hygiene is imperative for patient safety and for decreasing the risk of spreading infection. Sometimes we don't realize that what we do to one patient can directly affect the next patient that we provide care to. We don't know the type of germs or microorganisms that are lying in our patients or in our patients' equipment. See, if I would walk into a room, I don't realize that when I touch my hand down on the bedside table, I am putting my hand down on everything that that patient might be infected with. And then without washing my hands before touching the next patient, I'm transmitting any disease or infection that I might have picked up from my first patient. And so it's our responsibility to break that chain and to perform hand hygiene and meet our patient safety goals so that we no longer spread infection and we don't keep our patients in the hospital longer than they need to be, or worse, we don't cause them to become any more ill or cause our patients to maybe have a fatal infection. So these are some articles that I found that support good hand hygiene for our patients. This is an article that focuses on how hand hygiene protocols reduce HAIs. Improving hand washing practices is an effective method to reduce the prevalence of HAIs. Adopting a hand washing protocol will give nurses and patients a guideline to help improve hand hygiene. Following a protocol will reduce the risk of hospital-acquired infections and improve patient safety. So this shows evidence that having a protocol set in place on our units will improve our hand hygiene and in turn improve our patient safety. The next article that I found was a brief report that shows how priming hand hygiene helps compliance. Priming is a psychological process by which exposure to certain cues such as words, smells, or images alters behavior without the person being aware. Using a clean citrus smell and olfactory prime, which means you'd walk into a room and smell something citrus, has been shown to stimulate the use of hand hygiene. Using a visual prime, such as a picture of a person's eyes, has shown to increase use of hand hygiene. Using visual or olfactory primes in healthcare environments improve hand hygiene compliance, which decreases the risk of infection. This is something that might sound a little strange to us, but it is proven, and as this article states, that having these visual cues or these smells may increase our likelihood to reach for that hand sanitizer or reach for the soap in the bathroom. It's proven, so this might be a good thing for on our unit to maybe have a citrus smell while walking in, or maybe putting more pictures on the walls that maybe remind us that it is important to wash our hands. So these are the references that I used in my article. So I hope that you enjoyed this presentation. I hope that you take something with you and that you adequately use hand hygiene in your patient care as you go back to work on your next shift. Have a great day.